when we want to change any behavior or alter any behavior, we first need to go through this assessment part. We need to find out the triggers. If we are able to find the triggers, that means they are serving our functions. Parent, again, need to understand that when they are in that meltdown state, we need to be calm. If the intensity is too high and reinforcement technique is not working for the child, we need to seek the help of medical professionals.
Hello everyone, welcome to India Autism Center podcast, your go-to destination for insightful and inclusive stories on autism care, neurodivergence, and above all, community awareness and empowerment. I'm your host for the session, Ms. Pooja Datta, and today we will be focusing on a topic that almost touches every parent, caregiver, professionals, therapists who are working in autism care and management, and that is the importance of behavior therapy in management of problem behaviors in autism. So today we have Ms. Sucharita Datta with us, who is an RCI registered rehabilitation psychologist and a lecturer in rehabilitation psychology. She has an immense experience of over a decade in behavior management of individuals in the spectrum. Dr. Dutt, thank you so much for being here at India Autism Center podcast. How are you today?
Yeah, I'm fine. Thank you for your invitation.
Ma'am, can you please share a brief journey of your professional career and how it aligns with autism care?
I joined the field of disability in 2007, where I started initially with assessment. Later on, I moved into the parental counseling and behavior modification. In 2007, the term autism was not so buzz like today it is. Gradually, we move on with the assessment part that there were few features which were coming, which is not aligned with like intellectual disability, the cognitive impairment child. There was something different. From there, I move on to the classification, moving on to the diagnostic part, and then involve ourselves in different strategies that evolved in the current scenario. And especially during the COVID time also, we found that there are lots of cases coming up which were like aligned with the symptoms of autism. From there, I might be saying that I moved on to this field into the developmental disabilities, the whole broader aspect of the developmental disability.
Thank you, ma'am. So today, Sucharita ma'am, she will be taking us through the practical problems that children with autism they face in their day-to-day living and the solutions and strategies that may be of help. So ma'am, let's move straight into it.
Okay.
Behavior therapy. For many parents, they come across this term very often. And ma'am, to you, if you can give us a very simplistic definition of what behavior therapy is and how does it look for an individual with autism who is pursuing the therapy?
Behavior, first let me explain the term behavior. Behavior is something which we does. Everyone is doing something, like we are talking, that is a behavior, right? So the root of this behaviorism came from the learning principle, which is based on reinforcement and punishment. According to this principle, all behavior are learned. We learned behavior, and therefore we can unlearn them also. So we can modify the behavior. So if a child is depicting an maladaptive behavior, so as far as a behavior therapist, we can change or alter the behavior using the principle of reinforcement. So when we are talking about reinforcement, we mean that when you present the child something which he likes, a pleasant stimulus, then there is a probability or likelihood that the child will repeat that behavior. So you increase the desirable behavior, whereas the maladaptive or the challenging behavior decreases. So the root behind this behavioralism or behavior therapy is to alter the challenging or maladaptive behavior. Now, taking this aligned with autism, we often found that children with autism also engage in few behavior which are not socially accepted, which looks very odd, right? So we can apply this principle of reinforcement in treatment or dealing with children with autism. So a simple thing in behavior therapy that we need to know is functional analysis, or what we say is functional behavioral analysis or assessment. Until and unless we are able to find out the triggers why the child is engaged in such a behavior. So what is making the child do it? Is it a person? Is it a place? Or is it the time? So why? We have to find this why. And accordingly, we can change the antecedent. This why, the before factor is known as antecedent. So we can change the antecedent which is triggering the child. Similarly, when the child is engaged in some maladaptive behavior, there may be something that the child receive, a reward, a benefit. So the child has a tendency to repeat the behavior. So when we want to change any behavior or alter any behavior, we first need to go through this assessment part. According to the assessment, each child will have a different function. So once we have identified what is a function, what is a benefit, why the child is engaged in such a behavior, we can make the management plan. So the management plan will differ for every children. It's a tailor-made program. So focusing on the functional analysis, we can move on to either selecting the antecedent part or the consequent behavior. And then one necessary part is that follow-up. Nothing happens overnight, right? So we need to go through follow-up sessions to find out whether the management is effective or not, if there is a need to change the management plan. So follow-up is very important when in any kind of a behavior management or any therapy, parent need to come for the follow-up to find the effectiveness of the therapy.
Okay. So, ma'am, behavior therapy, it is also applicable to all children, right? It is not solely meant for autism.
When we are talking about behavior therapy, we are changing or we are altering the maladaptive behavior. So behavior therapy can be applied to any age group, to any conditions.
Also, ma'am, is it applicable for adults?
Yes.
It is.
Yes.
So, ma'am, you have seen in a variety of cases where this behavior therapy is also applied to adults as well,
definitely.
with good recovery, good prognosis.
Yes. If I come to the point, like behavior therapy is changing your cognitive thought process, is altering your environment. So in respective of all ages, we can go for behavior therapy.
Okay. So before we jump into the next question, please have a look at who we are.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
So hope you have liked this video. So now, ma'am, over to you with the next question. Many people, they confuse between applied behavior analysis and behavior therapy, and at times they use these two terms interchangeably. So can you please take us through the key differences between these two therapy modes?
both behavior therapy and applied behavior analysis are valuable approaches. Both are grounded in behavioralism, as I mentioned about the reinforcement and punishment. But they differ in their purpose and on specific population we can use. So the difference is between the purpose and the specific population. Coming to behavior therapy, it encompasses a variety of technique. You might have like not only the behavior therapy, we have like cognitive behavior therapy. So mainly behavior therapy is addressing the psychological and the behavioral issues common, if I name it, like anxiety, depression, OCD, post-traumatic stress disorder, like this many more. But when we talk about applied behavior analysis, its primarily focus is on developmental disability and particularly to autism.
Okay.
Right? ABA we usually associate with ABA and it is more structured and it focuses on teaching skills like social skill, academic skill, communication skills, along with that, how to reduce the maladaptive behavior. So once I'm using the behavior therapy, it is more flexible. It's depending upon the individual need, changing their cognitive thought process, trying to improve their mental health, psychological well-being. Whereas if I consider the ABA, it is highly structured. We have teach the structured teaching. Like this, it is structured where we have an idea, predictability, what I'm supposed to do. And it progresses through a very meticulous observations and planned carefully so that we find the effectiveness. And moreover, for ABA, it is like I'm saying is highly structured. The interventions are also empirically evidence-based. So it's data-driven, which is not in behavior therapy. So the purpose and the population, basic difference is there. Otherwise, both, the similar front, both are based on the behavioralism approach. That is, both are using the reinforcement and punishment technique to teach any behavior or reduce problem behavior.
So, ma'am, is it that behavior therapy, it is less often used for children with autism? And we go for applied
We go for applied behavioral analysis because we need to teach them what they are supposed to do it. Whereas behavior therapy where we are applying an anxiety, okay. So they know that what I'm supposed to do, but I feel anxious, overwhelmed. So I can manage it. But for them, it becomes difficult. So we need to change the environment. We need to make the environment highly structured so that they can adapt to the situation. So there is a difference when we are going for behavior therapy and ABA. ABA, again, as I said, it's meant for developmental disabilities and particularly for autism.
Okay, ma'am, this is very clearly said because at times parents, they are even concerned which therapeutic mode to approach. So to the viewers out there, if you are watching this video, please hit the like button and do subscribe to our channel to stay updated and connected. So ma'am, over to the next question. There is a debate that behavior therapy, is it ethical because it focuses solely on the behavioral component. So at times we know that, behavior, cognition and emotions, they are all interrelated. We cannot isolate behavior from cognition and emotion. So as a therapist, what is your take on it?
Definitely, behavior is important, but it is not the one-size-fits solution, right? It is important that behavior become a part of this holistic approach or the child-centered approach. We cannot separate the child from its cognitions and emotion part, right? So we need to incorporate in behavior therapy also the cognitive aspect as well as the emotional understanding. So when I'm talking about this ABA part, it is focusing on that only. It's teaching the cognitive skills. It is teaching how to regulate your emotions. On the other side, we are using the reinforcement technique to improve the behavior. So we are accumulating all the three components. The human complexity is built with these three components. So we are incorporating it into the behavior management plan also. Solely behavior cannot give us that full result because people have their emotions also. So we need to incorporate the three components.
So, ma'am, is it a myth that behavior therapy, it makes a child more robotic and mechanical?
It's not like robotic or mechanical, but behavior alone cannot bring a change, right? We are living in an environment, we can change the environment, but a child also has feelings,
True.
emotions. So we need to keep that in mind also, and accordingly we can incorporate that feelings component also and go for the management part.
Okay, ma'am. So, ma'am, moving to our next question. We know that individuals in the spectrum, they have a lot of repetitive behaviors. For example, the stimming behavior. So, it is a concern that do parents, they need to be worried about these stimming behaviors or repetitive behaviors? If yes, how to handle these repetitive behaviors?
This repetitive or stimming or self-stimulatory behavior, which are the common characteristics or criteria of autism, right? Which usually involve like physical movement like hand flapping, body rocking, and even vocalization like repetitive speech. So keeping this in mind, this is a way they try to communicate. They try to regulate their emotions, manage their stress, maybe fear, or when they are overwhelmed or bored. They express it through this self-stimulatory behavior. So this self-stimulatory behavior is not always harmful. It is harmless, but is often appear unusual. So we need to address why the child is engaged in this self-stimulatory behavior, because it is serving a purpose. So rather than suppressing that self-stimulatory behavior, if we teach the child some alternative behavior, like for example, a child who is engaged in hand flapping, we can give them the ball to squeeze or any other hand motor activities where he will be able to fulfill the same need but with some meaningful activities. Or if I'm in a crowded situation, I'm in a party or I have gone to some festivals and there are too much of light or too much of sound, so overloaded with sensory stimulus, so I might be jumping. So I need to maybe use headphone for noise cancellations when there are too much of sound, or I can use some glasses to cancel the bright light. So we need to find out the triggers. If we are able to find the triggers, that means they are serving our functions. So what functions they are serving? If we are able to find that functions, we can cater to the need of the child. And stimming behavior or self-stimulatory repetitive behavior can be managed.
So, ma'am, is it that behavior therapy doesn't mean suppressing the behavior?
Not at all. We can teach some alternative behavior. Like we don't want that hand flapping part. Maybe sometimes in dance we might require hand flapping. So if we suppress that behavior, he won't do that, right? So rather we are channelizing it some alternative behavior where the child's needs are also met.
Right, ma'am. So, ma'am, now these were the repetitive behaviors which are not always harmful. Now, talking about the self-disruptive behaviors like hitting self, biting self, as well as harming others, these behaviors, they are at times, a lot of concern for the families. They worry a lot. So, ma'am, how to handle these self-injurious behavior as well as harmful behavior to others? Can you please tell us some strategies?
Yes. Again, when we are trying to find out or give management for this self-injurious behavior, again, I would say that for every child, the need differs. So we again need to go for the functional analysis, and accordingly, like if the child is hitting himself because he does not want to do that activity, it is not his preferred activity. So he is self-hitting himself. So we can break the task. We can tell, okay, you first complete this, then we will give you what preferred activities you want. So there is like alternating behavior, or we are breaking the task and we are using the first then principle. You complete this, then you will get what you are liking it. And we need to consider the intensity when we are dealing with self-injurious behavior. If the intensity is too high, and reinforcement technique is not working for the child, we need to seek the help of medical professionals.
Okay.
Because it might be harmful to self or harmful to others. So when you're providing a reinforcement to the child, he may not be able to understand what is reinforcement because he is in some other phase where some kind of medications might reduce his arousal level, and then we can go for the behavior therapy. That intensity of self-harming or self-injurious behavior, first we need to take into account, and accordingly we need to go for the behavior management plan.
So, ma'am, like you said about medication, so that is when the behavior that is too intense and very harmful. So, when you explain this to the parents, how much are they flexible to taking medication, knowing that their child needs it?
Yes, it's depend upon the psychoeducations. Because once we are giving them the reinforcement technique and it is not working for the child, because as I said, the child is not in that state to understand that I'm getting something pleasant thing. He or she is in that stimming behavior of self-harming. So there the arousal level is so high that the reinforcement won't work. So definitely we need to psychoeducate the parents the consequences that the child might have in the long run, and accordingly we have to counsel the parent for medication. Again, as I said, it is for the intense behavior where the frequency is too high that cannot be controlled by reinforcement, then we are shifting to medication. Like if it is like maybe the frequency is less and the intensity, severity is also less, the child does it deliberately, right? Whenever that activity is given, slightly he hit it. Then we can use for the behavior modifications or behavior technique where we can like say you complete it, then you will get access to the toy or you will get your me time. So likewise, we can associate it. But when it's in a intense state, there we need to go for the medication.
So, ma'am, again, this therapy, it needs the active collaboration of the
Yes.
parents,
Exactly.
without which no therapy works.
Because the functional analysis part, the parents only need to provide us with the triggers. So why the child is doing it. So they need to have a record of this antecedent and the consequences. Then only we can have the appropriate management technique.
So, ma'am, can you please take us through any such event or case where you have seen that these self-destructive behaviors, this was difficult to manage, but ultimately it was managed with behavior modification?
Yes, it happened like this, that a child who was supposed to go to a school, okay, and without mother, since they have that stranger anxiety, unknown place was there, new friends, new teachers. So the mother, he would sit in the class if mother was there. Now school will not permit it. So we made it in the sessions like mother will sit, you complete your work. So then after that, we did the fading part. Like mother will be there, but behind you. Again, outside the room. And then mother will pip, but again will not be able to see. During this frequency or during this fading part, the self-biting, the child has self-biting behavior. He used to bite himself. So what happened? When mother is there, the child was not biting. Mother was there. So we made it a safe place for the child. We made him understood that where you are without your mother is not always unsafe. We understand you and we acknowledge your fear or anxiety of being separated from your mother, and accordingly we introduce that small activities first with their preferred activities, then the less preferred activities. Gradually we had that understanding with the child and we were able to make him generalize this activity in school.
That's great. That's great. So it was over a course of time,
Yes,
like gradually.
definitely.
The mother was also very cooperative.
Yes.
So, ma'am, how far does this behavior therapy work with children who are nonverbal, who cannot speak or communicate?
For non-verbal also, we have like the PECS, Picture Exchange Communication System. where often they have difficulty in expressing their need, right? They might be wanting a glass of water, but they are not able to express, may not be able to point, but maybe showing some temper tantrums. So the parents again might have misjudged, okay, the child may be having stomach ache. So sometimes we are unable to find out what is the need of the child. So again, it's a training part where a picture book is there. I want is there. Now there are many pictures, maybe sleep, break, or preferred activity, game time. So you put there what you want at now. So it's become communicable to the other. I don't have to ask you, do you want this? Do you want that? You are simply telling me through these pictures what you want. Even a simple part is like for toilet training. You can have that card with yourself within the pocket also. When you need to go to the washroom, you can just give the card to your teacher. And then they can use the washroom. Even in a classroom, if you are feeling like I'm tired, I don't want to pay attention to the class. So again, I need a break. So once you are expressing through that card for the nonverbal children, we are able to understand.
Now, this
So-
is also very, very meaningful for these children who really cannot communicate
Yes.
through words.
So we are able to understand,
Yes.
and accordingly, we fulfill their need.
Right. And maybe the consistency is followed at home also. Maybe the parents, they are trained to
Yes.
use these
Yes.
systems for
From
children.
that only we will generalize it. First, the training has been given to the parent only to use it in different situations. And accordingly, the child will able to communicate. Over there, you does not need to be a trained in understanding this. Just a card can help you to understand, okay, the child's want this at present.
Okay. So, if you're watching this video, please hit the like button and please subscribe and share our videos. So, ma'am, over to you again. Now we will be talking about the meltdowns. We know these are overwhelming emotional outbursts, and this is not something that the child does willingly out of tantrum. These are neurologically different from tantrums. So, ma'am, what will be your take on this, and what kind of strategies the parents at home they can follow to address these meltdowns?
Again, a meltdown is a intense emotional response to an overwhelming situation that may be sensory based or emotional based. So once the child is showing behaviors like sudden shouting, screaming, crying, or kicking or biting self, so he's not doing it because intentionally or because he wants to engage in bad or naughty behavior. It is because he is losing control in his behavior. Again, there is like he is not able to tolerate this announcement that is happening in the railway station. So he might be started screaming. So again, the policy is that we used to minimize the trigger. So parent again need to understand that when they are in that meltdown state, we need to be calm. We need to give them that time to recover from this overwhelming informations or sensory stimulus. Once they are calm, we can calmly ask them, are you okay? Keeping in mind that they might require more time. Depending upon their overwhelming situation, we have to keep in mind they might require more time. In home, we can have a quiet place where there may be minimum distractions, less. The lights might be turned off. If there is sound, the sound can be turned down. People should not be staring at them. They should continue with their work, or they should leave the child, giving the child that time to calm down. So again, it's depend upon the triggers. But the good news is that you can prevent meltdown. So again, the task is that before they become distressed, they give a sign. So it may be like the child you're finding it, he's withdrawing. He's moving into the corner, or he's being quiet, or maybe for reassurance, he's asking repetitive questions. So they will give you a sign of distress. So once you have identified that sign of distress, you again can minimize the trigger. You can prevent the meltdown. So what parents need to do to identify the triggers? They need to maintain a diary
Okay.
where over a period of time, they need to record what are the before, during, and after factors of each meltdown. So there may be some particular time, particular place, particular things that might have happened. So we again, parents once have identified this pattern, then we can change the stimulus. We can change the triggering factors. So once we are able to change the triggering factors, again, we can control the meltdown.
So it is very systematic and structured documentation is needed
Definitely.
for reducing the frequency of meltdowns.
Functional analysis is a highly structured one with
Yes.
documentations and data. You have to
Right.
collect the information of each and every meltdown or each and every behavior.
And that is why it is evidence-based now.
Yes.
Okay.
Even the intervention also will be based how it will be how it has been effective before.
Right. Very, very insightful. I hope the parents, they will also be relating with this. So ma'am, now what about school? At school, when children, they are having these meltdowns, it becomes very overwhelming for the teachers when it happens in between the class. So what strategies would you recommend to the teachers for managing these meltdowns at school?
First of all, I would like to request all the teachers in the regular school to be very calm, patient, and respectful towards the child. Because again, as I said, the child is not doing it anything deliberately. If we provide the support to the child will able to understand that I'm not alone. There is someone who will take care of me. And the task of the teacher during this situation is to keep a log where again they will also record what are the triggers for this each meltdown. It might be like there has been a sudden change in schedule. The timetable has changed. The task that has been given is a difficult one. Or there may be sensory overload, loud noises. So all these factors in the classroom, the teacher need to identify. That is the first task of the teacher if you want to manage it. So you have to collect those informations
Yes.
and keep it ready for that particular child. And accordingly, you can use or you can take the help of visual support, visual schedule. You can make it so that you are more predictable to the child. There might be a transition, like from English class to Hindi class. So the child, you're preparing the child before by giving them that visual schedule. Next class is your Hindi class. So the child is prepared. Okay, my English class is over. Next, I will be having my Hindi class. Or suppose in the examinations, maybe 5 more minutes is left. So a warning sign. You have 5 more minutes. We also used to get it, right?
Yes.
Before our exam is to get over. So they also need to have this warning sign before this transition, before you're saying, okay, your 1 hour time is over. So give them the warning sign. And like suggested in home, in school also, if there are possibilities, we can have one small room, a quiet corner, where there might not be bright lights, no sound, a comfortable couch, or maybe some sensory materials would be there. So the child can go there, sit down when they are feeling overwhelmed. With that, when the child is overwhelmed, teachers should not go for like scolding them
Yes.
or punishing them. And the minimum uses of language as possible, that should be used. Visual timer, again, this is your timing part. Okay, you have a clock in front of the child. So the child knows, okay, this is my time for this class, I have to change. So we need to prepare the child for any kind of a changes so that the child knows, okay, I have the next thing to do or what will be my next target for. So accordingly, we can handle the situation in school also.
So ma'am, with this, the teachers even they need to be quite adept at, at addressing these problem behaviors of children at school.
Definitely.
Are there any sensitizing or orienting programs for the teachers?
Schools are now conducting like mental health programs. Many schools are conducting which are having inclusive setup. So we are providing, many other psychologists are also providing the orientation program, how to handle the mental health issues of children with special needs. So maybe in days to come, people will be able to identify the triggers. It is important first to identify the triggers, because once we are able to identify the triggers, we can modify the environment. That is the basic of behavior therapy.
Okay. Okay. Thank you so much for your insights, ma'am. Now, moving on to a very specific question. Feeding problems and behavior modification therapy. Is behavior modification therapy applicable for children who are having restricted feeding patterns or who are having feeding problems?
Yes, definitely. Behavior modification, again, based on like reinforcement technique. But over here, I would mention like if a child is having like oral motor issues, then a speech language therapist or pathologist, we need to consult them. If there is an like refusal for food due to sensory issues, then again an occupational therapist might be of help. Suppose the child is again deliberately, without having any feeding difficulties, is not prefer to eat something. So we can again use like the breaking down the task, like the shaping principle or the chaining principle. We can use those tasks. Like if I give you an example, that I don't like to eat carrot. So when I have placed the carrot on the table and I'm looking at the carrot, I'm being, wow, you're looking at it. So you get a star. So maybe a star is drawn on the hand or given on the token board. Then maybe the child is taking the carrot and maybe touching it. So again, a reinforcement can be given like, wow, you have touched the carrot. So you can, might be getting an access to a toy that you like. And maybe later on, this is a shaping principle, how we are making the child to eat. Then again, when the child touches the carrot, then or put it in the mouth, then we can again give a reinforcement to the child. So behavior therapists, when there is no like oral motor issues or sensory issues are not there, but they have a like, I don't want to eat. They're having a feeding problem. There we can go for the behavior therapy in addressing the feeding difficulties.
So, ma'am, again, can you please take us through any such, incidents where you have actually witnessed a child having feeding problems and behavior therapy has worked well with
Yes,
it?
mainly for the sticky part.
Okay.
Right? So ASD children with ASD usually have that aversions that I won't touch the sticky object. So how can you make them eat that? So one process is that using the spoon. So once they take the food by the spoon, then we give them the positive reinforcement. Okay, one spoon you take it, you get access to one of your toys. So you play it. Again, next you have to take it, then only you will get access to the toy. So first then card can be used for the child and we can make the child feed it. So again, you have to relate your non-preferred activity first and then your preferred activity. Accordingly, this association can be formed, and when I'm not interested in eating by myself, we can change it. Like the part, like the sticky part, so we used a modified. We use the spoon. So like this, we can change it, but the child will be eating by himself.
Okay, that's great, ma'am. Ma'am, any success stories of children with autism who have taken behavior therapy definitely for a prolonged time and now their behaviors have actually reduced to a considerable extent?
Definitely, it's a long process. Again, there was a child who came for like long back. I will be saying in my starting of my career. Okay, now he is an adult, and again, it would be saying like more what we have suggested, how to change the environment, how to handle the sensory issues. It was work of the mother also. She was very persistent in maintaining or using all the principles of behavior modifications, whatever we suggested. Why only the behavior therapist? Other professionals also, whatever they have suggested, mother constantly and persistently have followed their strategies. And today, definitely, I won't be saying the name, but definitely we can see that 17 years maybe he is at present, and he in one of the skill, may not be academic, but in a co-curricular activities, he is an independent fellow with award winning.
That's great. That's great. So behavior therapy has actually worked, because many parents, they at times feel that behavior therapy, it is quite restricted to behavior alone. So, ma'am, again related to this question, is behavior therapy applicable for high functioning adults?
Behavior therapy, ABA, can be applicable to high functioning also, even for children with ID also. So ABA teaches us social skill, communication skill, functional skill, academic skills, as well as if there is any kind of a maladaptive or challenging behavior, we can control it. So that can be used maybe for high functioning, adult, children at any age.
Okay, ma'am, that was really very, very helpful for us. And I hope the parents, even they can relate with this. So, ma'am, before leaving you, we will be having a quick, rather rapid fire round where I will be asking you a series of assumptions focusing around autism spectrum disorder. You have to tell me whether the statements are true or false, and a brief explanation as to why is it true or false. Okay, ma'am? So here we start. Behavior therapy works best when paired with emotional and cognitive approaches.
This is true. As I mentioned, like the child is a holistic one. We cannot segregate them, right, into a different compartment. So once we are able to have the holistic or child-centered approach, integrating all the three components, behavior, cognitive and emotions, the management will be more effective.
Okay. All repetitive behaviors need to be eliminated.
All repetitive behaviors are not harmful, so it may be false. We are not in a process of eliminating behavior, stimulating behavior or repetitive behavior. We can control that behavior. And the most important part is that, as I said it, every behavior is serving a purpose. So once we are able to identify, the focus should be on identifying the function of the behavior, and accordingly, we can teach the child some alternative behavior rather than eliminating the stemming or the repetitive behavior.
Okay. Meltdowns are a form of bad behavior and should be punished.
Not at all. It's false, because they are not doing it deliberately. Again, it's a way of expressing their emotions, their stress, their boredom, their overwhelming situations. So we need to understand those conditions, those situations, and accordingly, we need to cater to that individual's need.
Okay. Behavior therapy can improve feeding routines in autistic children.
Yes, with the principles of reinforcement, shaping, breaking the task into small units, in chunks, providing reinforcement to the child, definitely behavior therapists can help.
And last but not the least, teachers should always isolate the child during a meltdown.
No, not at all. They should be empathic with the child. They should understand and give the child to cool down, and again bring them back to the classroom and be together with other children also.
So, Dr. Dutt, it has been a very rich and enlightening discussion. So, to the viewers out there, if you feel that this video has been of help to you, if you feel that you have understood the basic essence of behavior therapy and how it can be used to address the problem behaviors of children in the spectrum, please share this video and please hit the like button and subscribe for more videos. Thank you so much for your patient listening.